Welcome to the selfgrowth.com show. My name is David Riklan, and I'm the founder of selfgrowth.com. Today, we'll be discussing how to restore fertility naturally. To help us understand this topic, I'm excited to interview Dr. James Vitale. Make sure to listen closely. We're going to be sharing a lot of information today. Before we get started, I want to take a couple of minutes and share some information about James. Dr. James Vitale has started his journey to healthcare over 25 years ago when he was living in Japan and found acupuncture. After experiencing the healing powers of this amazing medicine, he went on to a mission to study different forms of traditional healing, from acupuncture, shiatsu, herbal medicine, and energy healing. He has since earned his doctorate in acupuncture and has been in practice for almost 20 years. He's a teacher at the New York College of Health Professions, teaching advanced acupuncture techniques. He founded Suffolk County Acupuncture and has been treating a variety of conditions from pain management and sports medicine, anxiety and stress management, seasonal and food allergy elimination. But he's really specialized in the treatment of infertility. He works with many of the local IVF centers, being on call for pre and post IVF support. He is currently pioneering the use of laser acupuncture for the treatment of diminished ovarian reserve. To contact him and see more about what he's doing, I just want to give his website first before we jump in. It's vitalfertilitycenter.com. That's vitalfertilitycenter.com. James, welcome to our show.
Thank you, David. Thank you for having me.
All right, pleasure. I want to jump right in over here. So we're talking fertility. How did you come to specializing in infertility?
Oh, thank you. That's a great question. So early in my career, when I first got out of acupuncture school almost 20 years ago, most acupuncturists come out as general practitioners, and I had a focus on sports medicine, which is where my interest was very strong. But on a personal note, my wife and I decided to start a family, and we were having problems. And it turns out she had an issue. She had a blocked fallopian tube. So I consulted with my teachers. I took some classes. I studied as much as I could about it. And lo and behold, it worked. We were successful, and my wife was pregnant 3 months later. And it was a wonderful, wonderful thing I was able to do for us. We were very fortunate that we didn't have to go through the IVF process. And since then, I started bringing more and more patients. Word got out that acupuncture is a good thing. Around the same time, in 2002, is when one of the first studies that came out. Well, it's a very groundbreaking and landmark study that showed acupuncture improved IVF success rates. So around the same time, this all started to happen. And that's when my practice really took a direction on fertility.
Okay, sounds good. I get that completely. Your personal experience is going to impact you. So I was doing a little reading on this. According to the Center for Disease Control and Prevention, about 6.1 million women in the United States, between 15 and 44, have difficulty becoming pregnant or staying pregnant. 6.1 million. Those are big numbers. What do you think the cause of all this infertility is from?
Yeah, I guess I get asked that question all the time. And in fact, those numbers are higher. 6.1 is a conservative number. The actual rate is assumed to be between 1 in 4 couples and 1 in 8 couples experience fertility challenges. And it's across the board, all different age groups, although age does play a role, but I'll get into that in a moment. And it's not just the women, but men are half to blame. Half of all cases of fertility are related to male factor, either insufficient numbers, poor quality. There's so many factors, and I can get into that in a little bit. But the real reason, I think, there are many, many factors that can cause fertility problems. It's not just age. Most people think, oh, well, we're all waiting longer. And that is a factor. A generation or two ago, people were starting families a lot younger, in their mid-20s, early to mid-20s. Now, this generation and the generation just prior, we're waiting till 35 before we even think about having a family. And biologically, that's a little bit past what our genetics were programmed for. Women are in their fertile peak between ages of 18 and 26. After 26, it starts to go down, but it's not terrible. Once you hit 35, it starts to go down a little bit more. That is one of the challenges, is that we're waiting longer. But it's not the only challenge, because many people do get pregnant in their 30s and 40s if they're healthy. The bigger issue is, I feel, environmental toxicity. Environmental toxicity plays such a huge role, because really we've gone from a society of we've gone from a society that used to have I'm sorry, I'm losing the words here. In the last 20 or 30 years, IVF has become such a huge thing, because infertility problems have become such an epidemic.
Sure.
And the reason I feel that is because in the last 30 years, one, environmental toxicity has gone through the roof. There's over 90,000 different synthetic chemicals that are identified in food, water, air. It's everywhere. And they've only tested a fraction of them on the biological effects on the body. So that's the first thing, is that every day we're insulted by environmental toxins from drinking water, bottled water, tap water. All of it is bad. Food that has not been properly produced. If you have a lot of chemicals, a lot of synthetics, a lot of steroids, a lot of antibiotics. So there's a breakdown in the quality of our food. Makeup, skincare, all filled with parabens and other things that are endocrine disruptors. So when you look when you take a very close look at everything that could impact fertility and health in general, because fertility is just one marker of health, that the environment plays a huge role in that.
That makes a lot of sense. I recently read a story. Another thing they found is hair dye, coloring for your hair.
Yes.
There's so many places, and the number is staggering. You said 90,000 synthetic compounds that are kind of introduced, and it's everywhere. That's the crazy thing. We don't realize how many products that this is in, and no one's really done any long-term studies on what the impacts are, not only of each of them individually, but how they interact. The numbers are staggering. So I get that, and I can see how it would clearly, and it's impacting all of our health. It's going to impact infertility.
Absolutely.
And what is it that you do specifically to help couples become more fertile? So with your practice, I know the focus is acupuncture, but give us kind of a broad view of what you're doing and what you're finding is working.
That's good. So exactly, I don't just do acupuncture. We take a very holistic approach. When a couple comes to see me, and whether they've started the IVF process or they just found out that they're having problems, they come to me, and I do a very holistic approach, and I try and counsel them on every step and on every facet of life. We look at diet, we look at exercise, we look at the environment that they're in. We look at stress levels, which is another contributor. That's sure. One thing I didn't mention earlier. Another contributing factor is stress. The more stressed you are, the body doesn't want to produce. So we look at everything. We look at what they're eating and what they're not eating, what they should be eating and drinking. Exercise, whether they're exercising right, either they're exercising too much or not enough. There's a fine line. If you exercise too much, that can throw off hormones and throw off acid levels in the body. So we look at exercise, we look at the quality of sleep, we look at EMF factors, electromagnetic frequencies, cell phones. All these different things can play a role. So I look at that, I analyze that with my patients, both the man and the woman. And I give advice. Okay, eliminate this from your diet. Start adding this into your diet. Stop exercising this way. Start exercising that way. Move your cell phone out of the bedroom. Move the TVs out of the bedroom. There's drinking water. You should be drinking filtered tap, not bottled water, because bottled water also has a lot of toxicity in it. So there are many things we look at. And then I counsel them on making lifestyle changes. And in addition to the lifestyle changes, we also do a variety of treatments. Acupuncture is just one of them.
All right, sounds good. Now, can you give maybe a couple of suggestions for people who are just thinking, what are some things people might want to do on their own? So people are in the position, they're looking to get pregnant, they're having some initial issues. Is there any advice that you'd give people to get started with?
Absolutely, absolutely. So start cleaning up your diet immediately. Really look at food as a source of medicine, not as a source of entertainment. So if you're really serious about getting pregnant, really you want to spend a good 3 to 6 months preparing your body to become pregnant. If you're toxic now, and you're not getting pregnant, or if you're getting pregnant and having miscarriages, that's a sign that your body is toxic. So we want to clean up our bodies now, and it takes a good 3 months, maybe even longer, of detoxifying. Stop adding more toxins into the body. So the few things I recommend, one I just mentioned, filtered tap water, but not just a Brita filter. No offense to Brita, but the Brita only eliminates just a little bit. You really, to truly do a good job, you need something like a reverse osmosis filter on your sink, and a whole house filter ideally. I'm here on Long Island, New York, and just recently in the news, they found a whole bunch of chemicals in almost all of the water supply in Long Island that is not being filtered out by the municipalities. So we are constantly taking in toxins in our water. Bottled water, those very thin plastic bottles, also leach chemicals that are xenoestrogens. They mimic estrogen in the body, and they are known endocrine disruptors. So I immediately tell people no tap, no bottled water, filtered tap, good filtered tap, preferably reverse osmosis. Another thing you can try, please go ahead.
So it sounds like really good advice. And some of the interesting things about that is that's good advice in general to be healthy. And I guess the key is if you're looking to get pregnant, you want to be as healthy as possible. So a lot of this ties into being healthy. But it sounds like when you work with folks, with couples, you're taking really a lot of things into account, including obviously diet. You mentioned diet and exercise, a few other things. Now, I know some people kind of jump in and they've been trying to get pregnant for a while and someone's recommending IVF. Why just not jump in and do IVF?
That's unfortunately, and no offense to the IVF centers, I work very closely with many reproductive endocrinologists. I actually work with an IVF center where I'm on call for them. And I think IVF is an amazing thing when appropriate. And if it's a case where it's absolutely necessary, I think it's fantastic. Unfortunately, and this is the way it typically goes, a couple decides, okay, let's start a family. And they go to their, the woman goes to the OBGYN and says, all right, we're ready to start trying. Or maybe they're trying, they came off the pill a month or two ago. They say, let's try. 2 or 3, 4 months in, it hasn't happened. But all right, let me go to the doctor. So they go to their OBGYN and she says, well, try for a year and then come back. So they have to try for a year on their own. And percentage of them may get pregnant within that year, but many may not. And so after the year, they're like, okay, now let's do a fertility workup. Go see the reproductive endocrinologist at the IVF place. And then you start getting involved in that. So the reproductive endocrinologist will run full panels, which they should, and see if there are serious structural issues like blocked fallopian tubes, endometriosis, fibroids, anything that may impede the pregnancy. And in those cases, if there is blocked tubes, or if there's a serious case where IVF is the only solution, then that's the route they probably will take. But if you step back a moment and say, okay, that 1 year wait, I got to wait a year and I'm not making any changes. Well, what if I consulted with experts on nutrition, experts in lifestyle, experts in stress management, brought my body back into balance, made myself healthy? Then if it still hasn't happened, you're at least healthier when you do try and go for that IVF. Because it's not just about whether you become pregnant or not. The bigger issue is whether you're pregnant healthily. That is the baby going to be healthy. The quality of the mother's health translates into the quality of the child's health. And in fact, with epigenetics, they have shown that environmental nutritional impact can impact 3 generations. That a woman's health can be predetermined by what their grandmother ate, not just their mother, their grandmother. So if you want a healthy baby, you need to be healthy too. And going right into an IVF doesn't make you healthier. It may make you pregnant, but you still have toxicity. You still have all these things in your body that may be going on. But we want to get you as healthy as possible. So if you spend 3 months detoxifying, so I'd go through a detox protocol with them nutritionally and herbally. reducing stress levels, because stress will also impact a fetus or impact the health of a child. And we spend at least 3 months rejuvenating their health. Then if they do decide, okay, I have to do IVF, they're much healthier for it.
Sure.
Oftentimes during that time, they will get pregnant on their own.
All right. Well, that makes a lot of sense. As I mentioned, these are things you want to be in the healthiest position you are, regardless of whether you need to do IVF, if there's surgery that needs to be done, whatever it is, you want to make sure that you're in a position to be your strongest. And not only physically, as you mentioned, it's interesting, you take things like stress into account and you work with them not only in terms of the physical health, but in terms of emotional health, psychological health, and you bring it all together. So I like that concept. So one of the things I want to talk to you about is, I know you have something called the Vital Fertility Method. What is this? What's the Vital Fertility Method?
Well, this is something that I've been developing probably for over the last 10 years. And it's a combination of all of the best holistic fertility treatments. We are incorporating, over the years, I've learned to incorporate many different aspects of different healing methods into my treatment protocols. So when I first started doing specializing in fertility, I primarily focused on the acupuncture part. And the acupuncture is very beneficial at doing many things in the body. The acupuncture is the main part that I focus on, but we do everything. Acupuncture, some of the health benefits for fertility are, one, it reduces stress levels. So when you get acupuncture done right, it takes your nervous system from fight or flight and puts you down into rest and digest mode, or what we call feed and breathe. Because when your body's in fight or flight mode, it shuts down all non-essential functions, so you can either fight or run away. And it doesn't want you to digest. Your body doesn't want to reproduce. It wants you to survive and get away. So if we take you from fight or flight and put you in rest and digest, now your nervous system goes into relaxation, blood flow is restored into the uterus, into the ovaries, and your body becomes more receptive. That's the first thing that acupuncture does. The second thing that it does, it improves blood flow into the uterus, into the ovaries. So you have a thicker lining, you have a more receptive environment for implantation. The third thing that the acupuncture can do is it can help balance hormones. With acupuncture, we can help trigger or help balance the HPO axis, the hypothalamus pituitary ovarian axis, which basically restores balance in the entire reproductive endocrine system. And that's just the first part of it. So besides the acupuncture, part of the Vital Fertility Method that I'm developing or have developed is, in addition to acupuncture, of course, nutrition and herbal medicine. So we do general nutrition and nutritional supplements and Chinese herbal supplements tailored to the patient's needs. And what Chinese herbs will do is it will basically help strengthen a person's system. So everybody's different and they're tailored to everybody's specific condition. And it helps restore balance to the body and just makes them stronger. In addition to that, we also do guided meditation in the treatment room. So we have specific guided meditations while they're laying with needles, and while they go home, they also continue guided meditations, because your mindset is equally as important as your physical body. If you're super stressed and having negative thoughts all the time and think this is never going to happen, this is never going to happen, then you're sending your body a signal. So if we can change that signal with some people call it self-hypnosis, other people call it guided meditation, pretty much it's the same thing. It's subliminal thinking. It's how your subconscious thinks about something. And if we can change that into a more productive thought pattern, your body will start to believe it more. So we work on the thoughts too. We'll work on stress levels. If there's some severe stress, I work with counselors. And so they're able to talk to counselors and really get some talk therapy, which is also very beneficial. Also within this Vital Fertility Method, there's fertility massage. Fertility massage, I work with some massage therapists that do a fertility massage on the abdomen that helps break up adhesions, restores more blood flow into the uterus, into the ovaries, into the fallopian tubes, and pretty much revitalizes the entire reproductive tract on women and also men, but mostly women. Another key aspect of my Vital Fertility Method is laser acupuncture. Very, very powerful. Only in the last couple of years has there been some very compelling research showing how specific wavelengths of laser can actually improve ovarian function.
So what's interesting, what I find very interesting, is you have some expertise yourself, but what you're really looking to do when you work with couples, not only work with the woman, but work with the man in this, is bring in a wide range of techniques or modalities, what I describe as modalities, to really prepare people so they have the greatest chance of getting pregnant. And what I like about what you do, it's not just you. You're not coming in and saying, "All right, I'm an expert in acupuncture." What you're really doing is bringing together a wide range of different people, different techniques to give people the best chance to naturally become pregnant. And that's very powerful, because typically when you're working with someone, someone who's an IVF expert, they're going to tell you to do one thing. You always tell someone, if your only tool is a hammer, everything looks like a nail. So what I like about what you're doing is you really bring in a wide range of tools and techniques. And I found it interesting also that you work with people who are also doing IVF. So you provide some pre and or post work with IVF. So regardless of what issues people are having, you'll work with them and improve kind of their overall likelihood of benefiting, of increasing the chances of getting pregnant, of increasing it. And I think that's really, really powerful, whether it's, as you mentioned, acupuncture or meditation you bring in, or talk therapy, or whatever the piece is. And I like the fact that you bring that all together, because we're a holistic being. There's a lot of pieces to the puzzle, and it looks like you're really focusing on bringing all this together. So a question, you've been doing this for a long time. How successful has this been in terms of bringing this all together for people?
Since we started incorporating all of the missing pieces, our success rates have gone way up. Earlier, when I was just doing acupuncture and some herbs, my success rate was pretty good, but there were many cases where it was just, it's still not happening. And, everything looks great on the surface, but we still haven't been able to figure out, well, why isn't it still happening? So then I started building a team. I started working with specialized massage therapists who specialize in fertility massage. And I said, everybody, just get fertility massage. And those cases would see some more improvement. And in other cases, there would be just a lot of just mental anguish. And I'd say, you need some therapy. So I'd work with a therapist who incorporated talk therapy and hypnosis. And those patients started seeing more significant improvements. And when they were compliant with the dietary changes I suggested, those people started seeing more improvement. So I started just putting all the pieces of the puzzle together and saying, well, why not create a system that just automatically incorporates all of this? So we're not leaving anything out. We're not leaving any piece of the puzzle missing. And when they do this, when we do everything together, our success rates really started to come up, because we're treating the whole body. We're not just treating, one needle goes in where, the ovaries are, and another needle here for stress.
Right.
We're treating everything. We're treating the entire being, mind, body, and spirit. And when we do that, everything improves.
Oh, that makes total sense. So I mentioned this earlier. What's the best way to contact you or get information or more information about your work? Is it primarily to go to your website?
Website is the best. Yeah, website, vitalfertilitycenter.com.
Okay, so that's vitalfertilitycenter.com.
Yes.
All right, so we've covered a lot of information today. Before we go, is there any final message that you want to share with people?
I do want to backtrack for a moment where you started to talk about the IVF and how I work with the IVF.
Okay.
And we work very well with IVF centers. And the reason is, right now, and especially the ASRM, the American Society of Reproductive Medicine, endorses the use of acupuncture before and after IVF, because it does improve success rates. And recent studies have shown that when a patient gets just those 2 sessions, if they've never done anything else but get acupuncture just before and right after, they'll see a significant bump in success rates. But if someone got 2 months of acupuncture leading up to the day of transfer, those success rates were much higher, and they lasted longer, less miscarriage rates and higher full-term pregnancy rates. So the thing to take away is, getting acupuncture leading up to IVF is very, very important to just maintain your health throughout that process. And the IVF centers really should appreciate us because we're bringing them healthier patients.
Sure.
And their rates, their success rates improve when someone gets acupuncture over the long haul. So if someone is considering IVF, and if it's a case where they have no fallopian tubes or they have to have IVF, acupuncture still is very beneficial. And doing it all: nutrition, herbs, meditation, massage, the laser.
Sure.
All of that's just going to make somebody healthier. And if they do the IVF, they have a much higher chance of success.
All right. Sounds good. It makes total sense. And it's interesting. I find it very interesting that they've been doing studies with IVF, and the acupuncture is absolutely working and now recommended. So it makes sense. And of course, taking all these pieces into account, which is what you're really doing when you're working with folks. So let me just give out the website one more time. It's vitalfertilitycenter.com. I know we covered a lot of information today. If you have any additional questions, you can always get in touch with the center, Dr. James Vitale. Thank you for joining us today.
David, thank you very much for having me.
You're welcome. And I want to thank everybody for listening. And I want to wish everybody great success in all areas of their life. We'll talk to everybody soon.
Thank you.
Bye-bye.